Division of Public Health Services.
So moved.
Motion, is there a second?
Second.
Okay, thank you. We have a motion and a second. Any discussion on items 21 through 27F? Councilor Wheeler.
Thank you, Governor. Item 22 is for $13.5 million for mobile vaccine vans and personnel, I assume. Can you tell me how many vaccinations you expect to get for this $13.5 million?
We have no way to know that before we start the process. This contract will be responsible for doing all of our homebound vaccinations. So for our elderly and the infirm that are home and can't get to a vaccination clinic, they will be doing those. They will be doing stand-up mobile sites across the state. They will be doing boosters. They will be doing first-time shots. So they will be doing all parts of the vaccination. So we can't estimate how many at this point because we don't know what the uptake is going to be on boosters. We don't know what the uptake is going to be on kids getting vaccinated from 5 to 11, which is supposed to be coming out soon. We do know that several thousand people were homebound and got their vaccination through our homebound program. This contract will be also taking care of that.
Further question, Governor?
Sure.
Is this limited to just homebound?
No.
It's not limited to homebound.
No, so the vaccination program through Onsite is going to be mobile clinics that are going to stand up across the state, so pop-up mobile clinics.
And do we have a metrics in place to measure what we're getting for our money? How successful we are with this $13.5 million?
They have to report each vaccination to the Department of Public Health. Yes.
And that information would be available publicly?
The number of vaccines, yes.
Yeah, just the number, not names.
Yes.
Thank you, Governor.
Councilor Stevens.
In regards to 6 sites, the goal is 5 sites, 60 hours per week. Roughly, you're going 7 days a week, so the goal is 1,400 vaccines per site. Is that correct?
What are you still on number 22?
22, yes.
I would have to look at the contract and see what the numbers are specifically. Really, our conversations with Onsite is around our need. So although we may have a minimum of 4 or 5 sites in there, if we have to ramp up and do additional mobile clinics, for example, we did those for elderly housing units and things like that, they're more than willing to stand up and do additional ones.
Councilor Wheeler, sure.
One further question, is any of this paid for with the money coming in if 9B or D were passed?
This is FEMA reimbursed.
Excuse me?
This is FEMA reimbursed.
Thank you.
Separate funding, federal money,
Yeah.
separate funding source. Yes, Councilor Kenny, sorry.
Governor, just had a question as well on this contract 22. There's been an uptick in athletic parks in the state with regards to the public numbers in Swanton County and the southwestern New Hampshire. So when you look at these mobile sites through this contract, are you prioritizing those mobile sites to those areas?
We're going where the need is. So one of the things that we ask and we keep track of is what the hospitals can handle and what the private sector can handle. So initially, before the surge in Coos County, the hospitals in that area said that they were more than able to handle that surge, the vaccine clinics. Now that they're having a surge, yes, that is exactly what we would do. We know the hospitals are spent, they have staffing issues, they have high COVID numbers. So if we can go up and supplement if we can go up
Okay, I'm going to pause the meeting and ask again that you cannot be disturbing the meeting. By all means, we want the public to participate, but the repeated disturbances are not going to be, we're going to have to ask you to leave, and we want folks to be here. We want the public to participate, but it has to continue, again, allowing the state to do the business of the government. So, sorry, proceed.
So as the hospitalization rates increase in the North Country, that is exactly what this contract would do, is to go up and supplement the vaccine clinics in the North Country so that they can concentrate on providing care in the hospitals and not so much on the vaccine.
Okay, thank you.
Yep.
Councilor Gatzis.
Thank you, Governor.
Can you tell me how we spent the first 2.2 million?
Are we still on number 22?
We're still on 22.
I can get you that information.
So we've increased from 2.2 million for whenever this started to 13 million for 4 months.
The state has initially had over a dozen fixed sites that we were doing vaccinations with the assistance of National Guard. We no longer have those vaccine sites now, and we're relying on our contract services to do all of it.
And that's
That's what this is,
4 additional sites?
at least 4 additional sites. There will be much more than that as smaller mobile vaccine clinics and the homebound population.
What would you say is the percentage of vaccinated people in the state of New Hampshire?
We're right around 70%.
So we're doing 13 million for 30%.
We're doing 13 million for 30%, and then you have to add in the boosters, the third shots for everybody that got Pfizer. And then we're 70% of the eligible population. So that includes everybody over the age of 12. So very shortly, we're going to see approvals for age 5 to 11. We now have a third booster for Pfizer. We will see a third booster for Moderna. We will also see a second shot for Johnson & Johnson. So everything up until December 31st, on-site is going to manage this. I expect that as we continue to see additional boosters, additional age ranges, we may be coming back for additional money, or we may have to set up sites ourselves. It depends on whether the hospitals can manage the volume that they're going to have.
Counselor, go ahead.
Can you tell me how many folks that 13 million will accommodate?
I can't tell you how many people are going to take the vaccine in the future.
Thank you.
Thank you. Further discussion from any of the councilors? Any of these items? Councilwoman.
Yes, staying on 22 for now. So it would likely be, definitely be expected that it is more expensive to deliver vaccines to the homebound when you have to travel there and do one vaccine than to set up a fixed site and as with the National Guard and do many. Is that right?
Yes, it took us 3, 4, 5 months to do the homebound population, which was in the thousands, a couple of thousand people, versus several thousand doses of vaccine going out every day through our fixed sites.
And once the vaccines are approved for the 5 to 11-year-olds, we no longer have the National Guard sites for them to get vaccinated. So we will be relying on this provider and other contractors to provide these services. Is that correct?
I expect that children age 5 to 11 that want to get the vaccine, whose parents want them to have the vaccine, will get their vaccine either through a school-based clinic, through the regional public health networks, or through their local pediatrician. There may be some private vaccine clinics that are stood up, but we have a system in place. We do it with our flu vaccine at school-based clinics. So I expect that a lot of them are going to go through a very similar system.
And for assisted living facilities, where I know you were doing private setups, mobile setups, these kinds of setups will be done by these kinds of contractors.
This contract and probably several other private providers will do assisted livings. Nursing homes are doing their own right now, but assisted livings often don't have the medical staff to be able to do these, so they'll contract with, either have the state contract to win, or they'll contract privately with a private entity.
Thank you, Governor. I have more questions on 27F, but I just wanted to see if we want to finish the
Yeah, sure. If
discussion
anyone
on
has
22.
any questions on this item in particular? Councilor Wheeler?
Yeah, one further question is, what is the spread between vaccinated and fully vaccinated? What do both those numbers look like?
It's approximately 65,000 individuals
I have those
that have one dose versus two.
As a percentage, if you have it that way, please.
About 7% approximately. We'll get the exact number, but I think it's approximately 7%.
Yes, I do have those numbers, that you afterwards on the
vaccinated or fully vaccinated?
That is vaccinated. There's not a large spread between vaccinated and fully vaccinated. It's a very small spread.
Maybe subtract 7%.
Let's get 70% minus 7. The eligible population. One that has not been
Thank you, Governor.
Any further questions on this item, or we can always come back? Councilwoman, if you want an additional item?
Sure, Commissioner, I'd like to talk about item 27F, the family planning contract for the community action program of Merrimack counties. I'm glad to see this back on the agenda. I am disappointed not to see contracts for the remaining providers of parenthood, quality, and covering. Wondering when and would you expect those contracts to be brought back to the council?
I don't know what you want to talk to the department in the last week or so, and the RFP is currently out. So we do expect to bring, new contracts for the family.
Will that RFP be retroactive to July 1?
That, I don't believe.
So you still have providers in our state who are providing services and have been since July 1 at their own financial risk.
Yes.
And that those providers cover about 80% of all the family planning services delivered in our state. Is that right?
I'm gonna have Tricia come up and confirm that.
They provide a significant number, the number is probably in the 70 range, but in that, you get the exact number, correct. I will note that Planned Parenthood of Northern New England will have the opportunity to apply for federal funds this October, directly from the federal government.
And those funds will not be retroactive to July 1, is that correct?
That is unlikely. That will be their contract with the federal government, with the Office of Population Affairs. They will set the terms of that contract.
Okay. And without these remaining family planning providers, some counties in our state have no family planning clinics, including Sullivan County and Cheshire County, is that right?
That is correct.
And the services covered by these contracts include cancer screenings, breast exams, pap smears, STD testing and treatment, and contraceptive care, is that right?
That is true.
And the lack of contracts in these areas, or the lack of family planning services, will have negative health consequences for those who need these services. It will result in increased unintended pregnancies, increased teen pregnancies, and negative birth outcomes. Is that correct?
That is likely.
And I understand that some counselors here have indicated that they needed additional information about these contracts. Have you answered all of the counselors' questions at this point?
We believe we have answered all questions that have been asked to the department.
And still these contracts are not being brought back?
That is correct.
Thank you.
Thank you. Further discussion on this item or any items as part of 21 through 27F? Oh, Councilor Gatsas.
Thank you, Governor. Procedural question. How many times can contracts come before this council after we say no?
As many times as the governor wants to put them on the agenda.
I would request the governor put the family planning contracts on the agenda at every meeting until they are approved.
We can keep, they can. The governor said.
Can we fix that in the month?
Nope. Sorry. Constitution. Yes, Councilor Stevens.
In regards to 27E, the Maximus contract, there's a fee, a one-time go-live charge. We've had an extensive, long-term contract with this provider. Why are we getting hit with, six-figure go-live fee?
Thank you, Counselor. This particular go-live fee is in reference to this particular activity in which we are working to figure out, work with our data to ensure that folks have had their second dose of vaccine. As Councilor Wheeler asked earlier, there is a little bit of a spread between first doses and second doses. We know that in the early rollout, there may have been some data that was not captured, and so Maximus is working closely with the department to ensure that those folks get their second chances. And with this, there was some very specific training that was required to ensure that the call center was working with our vaccination program to ensure confidentiality and to understand the technical aspects of this particular task.
Did we ask and try to attempt to negotiate on this price? We did negotiate, right? On that fee?
I'm unaware specifically on this fee, but we did negotiate the overall contract price.
Thank you, Governor. I think this council was pretty clear about paying upfront fees. Probably 3 meetings ago, or the last time we met, or the time before that, but it was clear that we didn't approve of contracts that pay upfront fees. Love to hear your answer.
The funding for this, they will invoice us when they set up.
So it's a cost reimbursement for the setup, it's not an upfront payment.
Well, there aren't many companies that I know of out there that are public companies that people will give them a contract if they're paying upfront for a setup. This is a setup fee, and we're paying them whether it's coming back later. That's just the same thing this council said no to.
I don't believe it is. What the council said no to was an upfront advance payment to set up. What we had talked about was that most of these companies should be able to invest in the upfront costs without us giving an advance payment. So what we did is we changed our tactic with our negotiations so that they are required to do the upfront investment and then invoice the state afterwards their cost to set up programs. This is, I would say, pretty typical to have your costs reimbursed when you're setting up a new program. So we can either do it on a one-time payment on an invoice, or they can roll it into their monthly invoice. Either way, they're going to have their costs reimbursed, especially when they're setting up new programs in the state of New Hampshire. They have to hire people, do all of those things, maybe rent a building, that type of thing.
Follow-up, Governor?
Yes.
I can tell you that I would never approve this contract. You can call it whatever you want to call it. It's still paying for their setup, which is wrong. And this council shouldn't be there. We can do it whatever way you want to do it.
So the council is against reimbursing companies for their costs to set a contract.
Correct. If they're providing a service and the service is $3, then they should increase their service price to make the accommodations for those setup prices. But that's what most companies that are private companies do.
So you would rather see their setup cost integrated into their monthly invoicing instead of a one-time invoice cost after they set up?
I'm not looking to pay for their setup costs at all. You can twist the language whatever you want.
I'm not twisting the language, Counselor.
And what I'm looking for is for them to do business as most companies in this country do. If you want our business, come in and do the service.
If I may, when we set up a $50 million MMIS system with a lot of upfront hardware, it takes years. We pay for that hardware as they go before they bill us for the management of the system. To be fair, we don't pay for them upfront, but as they put in the servers and all this kind of stuff, it's multi-million dollars. We do pay. So there, I'm just saying there is a precedent here for especially when you're dealing with a tech system. They put it in, they send us an invoice, we move on. They put it in, and then we get to the monthly billing for the programmatic fees. I understand that you can do it, you can try to integrate that, but
I agree. I think that the impression that we were under during the initial conversation was that the council had a problem with paying money upfront before they started the contract. So the way we strategized was that we would have the company pay for those startup fees themselves and invoice them to us either.
Okay, we gotta take a pause here.
Why are we being arrested? What is wrong with this? Why are they being arrested? Stop it, now they're gonna arrest you. I'm not going anywhere, no. I'm not under arrest. I protected this country. This is how my country pays me.
AJ, just go. Your baby's sitting right here. Let's go. You guys are leave. You guys just took the husband out in front of his father.
We are the people. You're arresting the wrong people.
Come on, let's go. Let's go. Come on.
Fine. Why don't you arrest the damn emperor? Get out of here.
Are you kidding me? You just arrested his father in front of his face.
I didn't do anything.
So that is the way we structured it. Now, if they want to, the council would like us to take all of the service costs, individual invoices or subsequent invoices, we can do that, but I don't think a lot of companies are going to purchase hardware, buildings, and all the programmatic needs of big $50 million programs and not expect to get reimbursed for it.
Councilor Warren?
This structure is actually very typical for these kinds of contracts. I think Commissioner Goulet would probably tell us that with respect to all sorts of IT contracts. And I think the risk of advancing money up front is that we could advance money and then never get the product. But in this case, what the way the department has structured this, we are not advancing money, they are actually incurring costs and then being reimbursed for costs. So it's sort of a service plus cost contract, which is totally typical, to my understanding, in the industry. Is that correct, Commissioner? Yes.
Councilor Gabbard?
Thank you, Governor. I think Commissioner Goulet would say that they're not providing the service. They are doing work for the state government. So there's a difference between people providing the service, which actually...
So we just saw a lot of people got arrested for just speaking normal stuff. It's really strange. Joe Kelly from Local Media reporting live from Concord, New Hampshire at the Executive Council meeting on Thursday. It's Wednesday, October 13, 2021. Thanks for watching, everyone. Signing out.